Symptoms of ovarian cancer, when we go out and we do these symptom and risk health symposiums for people, we talk about the symptoms. And the first thing I say to people is, now listen, I know that I just scared you because I list things like bloating and urinary frequency. And women, all of a sudden, they kind of, their eyes get real big and they get real nervous. Mm-hmm. And the reason that is because these things mimic other things that are very common.
Welcome back to my YouTube channel. My name is Nefertiti DuPont, and I'm a board-certified gynecologic oncologist. I'm passionate about educating women so that we can live happy and productive lives, and I believe this starts with good physical health. Please click the subscribe button below to get more tips on how to improve your health. Well, September is Ovarian Cancer Awareness Month and also Gynecologic Cancer Awareness Month. And so I have the pleasure of talking to Kathleen Maxian today about the symptoms of ovarian cancer. Mrs. Maxian is the president and founder of the Ovarian Cancer Project. It's a foundation in Western New York that educates women and provides support services to women who are being treated and going through cancer care, who are being treated with ovarian cancer and who are going through cancer care. I sat down and talked with her about some of the common symptoms of ovarian cancer. And if this sounds good to you, please keep watching. And if you haven't subscribed already, please subscribe. And if you like this video, please press like. Thank you. All right, welcome, Kathleen. I'm so glad that you are joining me today. So September actually is Gynecologic Cancer Awareness Month, as you and I both know. And so there's so many women, and I've actually seen 2 this week in the hospital, presented to the emergency room with symptoms that as soon as they told me their story, I'm like, aha, ovarian cancer. But for these women, they had seen multiple people. No one had done a CAT scan. They wound up going to the ER because they just couldn't get answers. So let's talk just about symptoms, the symptoms of ovarian cancer, the things that you tell the women that you serve.
So thank you for having me. First of all, it's great to see you. The symptoms of ovarian cancer, when we go out and we do these symptom and risk health symposiums for people, we talk about the symptoms. And the first thing I say to people is, now listen, I know that I just scared you because I list things like bloating and urinary frequency. And women, all of a sudden, they kind of, their eyes get real big and they get real nervous. Mm-hmm. And the reason that is because these things mimic other things that are very common for women. A funny story that I tell is, my mother knew where every bathroom and every department store was in Niagara County. And so I assumed wrongly when I started to have to hit every bathroom when I was going out and really had a lot of urinary frequency, I assumed, oh, I'm just like my mother. I never thought when it started happening, I never thought, oh, that's really different for me. It's new and unique. So those are the things that we want to say to people is, look, this is very vague. It's very, very vague. If you have something that's new and different for you, that's constitutionally different for you, then you want to go to the doctor, right? Preferably a gynecologist, right? Mm-hmm. And then we tell women, look, what the gynecologist might do is they might pat your hand and say, Betty, you're kind of a hypochondriac. Or, Barbara, you're getting older and some of these things happen. Or, I don't think it's that. I think you have irritable bowel. Or, I think your gallbladder needs to come out. And let's do that. And the problem is that doctors are not, as you very well know, putting ovarian cancer on the differential, right? Mm-hmm. Which means they're also they're going to look at irritable bowel. They're going to look at your gallbladder because it very well may be those things. Mm-hmm. And it's most likely that it's those things because we know ovarian cancer is rare. But the one thing that we know about ovarian cancer is it's very deadly. And so what we want to do is we want to make sure that the doctor has that on their differential. And we can say, you know what, Dr. Bob or Dr. Betty, I just want you to test for ovarian cancer too. And we know there's no screening test, but we know that there's some other very inexpensive tests that the doctor can do to rule out ovarian cancer, right? It's not just one thing. And those are a CA-125, which is a blood test, which gives us some information. If you have an elevated CA-125, it doesn't necessarily mean that you have ovarian cancer. It means you have an elevated CA-125. If you do have an elevated CA-125, then we might take a next step. And as well, you're the doctor, you know this, that it would be a transvaginal ultrasound. We take a look at both those things. And then the next step is that CT scan. And also the most important thing, right, is the referral to a gynecologic oncologist like yourself.
I definitely agree. So typically when I'll talk to patients, I'll tell them about the bloating. Sometimes they'll feel fullness where they'll just eat a little bit and then they can't eat anymore. And so I tell them those are symptoms to be aware of. Most patients who are diagnosed with cancer, at least ovarian cancer, actually do have symptoms. And you're right, they are vague and they do mimic other things. But what I really want patients to remember is that these are symptoms that are persistent, that don't go away. So we mentioned the GI symptoms. There's also, I've had patients complain of a pain with intercourse. If they've got masses in their ovaries, sometimes just the jarring, with intercourse will cause pain.
Right.
Back pain is listed. I don't see back pain as much, but it is listed as kind of some of the symptoms. Sometimes I'll have patients with nausea and just fatigue. And a lot of women just say, I just don't feel right. They just know something's wrong, but they can't put two to two together. So then definitely, we'd like them to see their primary care doctor and just ask, could this be, cancer? Could this be ovarian cancer? Because it's something that's missed a lot. And then I think you mentioned also urinary frequency. I tell patients, it's like, when you're pregnant and the baby's pressing on the bladder, you have to go to the restroom all the time. Well, when those ovaries get enlarged or you have masses in the pelvis, your bladders can't expand. So you do have to go to the restroom a lot. So those are definitely great tips. And then you mentioned the CA-125. And I always tell women that in 80% of cancers, it's elevated, but in 20%, it's not. So you're right. It's not a great test, but it's the best we have right now. So definitely, I've had patients that come to me and want to know, ask for it. Definitely, I never turn anybody down, but a lot of women haven't heard about it. So definitely we want to increase awareness.
Right. Absolutely. I think for myself, as you know, because you took care of me, but maybe your audience doesn't, is that I am an ovarian cancer survivor. And I had those symptoms. I had that urinary frequency, I had the fatigue, I had the bloating. And I think the one thing that we do as women is, we're busy people. We're taking care of others. We're the nurturers. We're out there, taking on the world. And I really was kind of taught to, you brush it off and, oh, I'm fatigued. I need more exercise. I'm bloated. I need to go on a diet. Urinary frequency. I passed it off for quite a while before I called my gynecologist. So it's a difficult thing to do, hindsight being 2020. And I think you're absolutely right. I think we need to educate women on what the symptoms and what the risk factors are for this disease, because it's a very difficult disease, but caught early, women do really, really well.
Exactly right. Exactly right. And then we also talked about seeing your primary care doctor. Now, I do know not everyone has a family doctor. You may be seeing a nurse practitioner or physician assistants, and they're highly qualified. They may not see as much ovarian cancer as like a specialist would, but definitely, if something doesn't feel right and you feel like you're not being heard, keep following up, maybe see someone else or just go back. Because a lot of times, we'll treat patients and we give you medicines or we'll order tests. If we don't hear back from you, we think you're better. So we don't always know that you're not better, that the symptoms didn't go away. So if they don't go away, see your healthcare provider back and just say, yeah, I'm not feeling any better. I've had patients, get a x-ray of their abdomen or ultrasound of the abdomen, and sometimes it may not show everything that's needed. So if you're not feeling better, you're not getting the answers, keep going back or see someone else until you can get down, to figure out what's happening. Because I think the body is so wonderful. It kind of tells us when something's not right, and we just have to listen.
It does. We do need to listen, and you do need to be persistent. I know several women who had their gallbladders removed. They came to the doctor with these symptoms, and of course you get to a certain age and you need your gallbladder removed. It's not that you don't, but that kind of pain and that abdominal pain was not the gallbladder. It actually was the ovarian cancer.
Right. So we're going to go over the symptoms again so that you guys are aware. So abdominal bloating, fullness, abdominal pain, sometimes fatigue, getting full faster, pelvic pain, having to urinate more often or urinary frequency, sometimes pain with intercourse. So if you have those symptoms and they're persistent where they're not going away, you've had them for multiple weeks or even like a month or so, and it's just not getting better, definitely see your healthcare provider, because it could be something else. I mean, heaven forbid it's cancer. We hope it's not, but we definitely want you to see your healthcare provider to make sure that you find out what's happening, because your body's telling you that something's not right. Well, welcome back. Today we talked about the symptoms of ovarian cancer. I hope you liked the discussion I had with Mrs. Kathleen Maxian. Remember, some of the common symptoms of ovarian cancer are bloating, abdominal pain, urinary frequency, fatigue, weight loss, early satiety, which just means getting full faster after eating. If you have any of these symptoms, please see your healthcare provider. And remember, these symptoms are very vague and they can mimic other conditions. But the one thing that we've noticed with ovarian cancer is that most women do have symptoms, and the symptoms are persistent. So, if they go away in a week, then you probably don't have ovarian cancer. But if they've been going on for 2, 3, 4 weeks, then definitely see your healthcare provider. Well, thank you for watching. And again, if you haven't subscribed, please press the subscribe button. And if you like this video, please give us a thumbs up.